Hi guys, Dr. A with Hepatitis Serology Basics. We are going to look at Hepatitis C in this video. So Hepatitis C, HCV, is an RNA virus. It is mainly spread parenterally, which means IV or intramuscular, so like injected into the skin, the body. Although it can be spread vertically, so that is mother to child, as through birth, through pregnancy, or it can be spread sexually also. 70 to 80% of acute infection are asymptomatic, so no symptoms, and 70 to 80% of patients develop chronic disease. Many patients with the disease first present with cirrhosis of the liver or chronic elevations of the aminotransferases, so that would be ALT and AST, because the acute symptoms are so mild. Since chronic HCV infection is often asymptomatic, then high-risk patients should be screened appropriately. So who are the high-risk patients? There are patients that have a history of illegal drug use, a history of snorting cocaine. They have parenteral drug use, patients who receive clotting factors before 1987, blood products or organs before 1992. So if they've received blood products or organs before 1992, which is when they started to screen for hepatitis C, and a history of hemodialysis. Acute hepatitis C is often asymptomatic, or if the symptoms are present, they are usually mild. The diagnosis of acute hepatitis C is important since all indications are that prompt treatment with antiviral medications can prevent the progression to chronic hepatitis C in a majority of cases. Again, that's if they know they have it though. So screening is super important. Chronic hepatitis C, LFTs are minimally elevated. The AST and ALT values are usually in the 60 to 100 international units per liter range. The values can fluctuate and even return to normal for a year or more and then rebound when their levels are checked later. If untreated, within 20 years, 20 to 30% of patients will develop cirrhosis, and 1 to 5% of the patients will develop hepatocellular carcinoma. So how do we test for hepatitis C? First is the anti-HCV antibody, usually run with the ELISA method. It detects antibodies to several of the hepatitis C viral antigens. You will see positive results in patients who have passively acquired these antibodies, but not the infection, as in like after transfusions or children of mothers with hepatitis C. So there would be, they passively got it. The children got it from mom and the patient got it from the transfusion. So the antibodies are there, but they did not make those antibodies themselves. Okay. Positive results should be confirmed with a more specific assay, since this test has a considerable false positive rate, again, due to possible cross-reactivity with one of the other antigens, hepatitis antigens. So then there's the hepatitis C Ribot, which is a recombinant immunoblot assay. It is similar to the ELISA, but it tests antibody reaction to a panel of antigens individually, so one antigen at a time. Binding to 2 or more of the antigens is considered a positive test. Binding to one antigen is considered to be indeterminate. It is not used as much now since we have the implementation of the RTPCR testing. And so RTPCR is reverse transcriptase polymerase chain reaction for hepatitis C. It can detect hepatitis C virus within 1 to 2 weeks of exposure and weeks before seroconversion, so that's before the antibodies are detectable, and weeks before symptoms or the elevations of LFTs. Immunocompromised patients with hepatitis C can have false negative ELISA studies, so PCR testing is recommended for patients with hepatitis or chronic liver disease that are immunosuppressed. At least RT-PCR is not confused with passively acquired antibody that are present in uninfected infants or recipients of blood products, because it won't pick up on antibodies, because the RT-PCR is basically looking for the hepatitis C DNA, RNA, the genetic material, actually. So it can distinguish between resolved and chronic infections, and the results are reported in international units per milliliter. So following a definitive diagnosis of hepatitis C virus, there are different quantitative molecular assays that can be used to monitor viral load for assessing that patient's response to treatment. So things to take in consideration is, first of all, the molecular methodologies are not standardized, so there's a lot of variation between testing. You definitely should not compare one method with another. You should always stick, if you're going to trend or track a patient over time, you need to stick with the same methodology. They are, some of them are less sensitive than the qualitative RT-PCR. They can include a quantitative PCR assay and a branched chain DNA assay. So there's a variety of tests out there, and they are helpful. There are 6 major genotypes of the type C hepatitis virus. They are useful in determining the response to certain treatments. So like type 2 or type 3 genotypes for hepatitis C can be successfully treated with only 6 months of therapy, while type 1 may require a year of treatment. So again, doing the genotyping and some of these more specific molecular tests can be helpful in guiding therapy for your patients. All right, that wraps up hepatitis C. Thank you.